Mhm.
Okay. Okay. Go. Okay. Good evening, everyone. I'm Anita McBride. I'm the founding member of FLAIR and director of the First Ladies Initiative at American University. Now, I'm delighted to welcome all of you to tonight's program in honor of Breast Cancer Awareness Month, called Accidental Leaders. Betty Ford and Nancy Reagan speak out on breast cancer. By going public, these two courageous first ladies showed great leadership and transformed the conversation about women's health for generations to come. Tonight's expert panelists, Dr. Myra Gutin and Ms. Jean Wolfson, will come on later in the program to discuss the leadership of these two remarkable women. But before formally introducing them for this discussion, I would like to welcome Ambassador Nancy Brinker. Ambassador Brinker is indisputably regarded as the leader of the global breast cancer movement. Her journey began with a promise to her dying sister, Susan G. Komen, that she would do everything possible to end the shame, pain, fear, and hopelessness caused by this disease. In one generation, the organization that bears Susan's name has changed the world, becoming the world's largest grassroots network of breast cancer survivors and activists fighting to save lives. In 2010, Ambassador Brinker released her New York Times best-selling memoir, Promise Me, the inspirational story of her transformation from bereaved sister to indisputed leader on the ongoing international movement to end breast cancer. Ambassador Brinker served twice as ambassador to the Republic of Hungary and as U.S. Chief of Protocol in the administration of George W. Bush. And in 2009, was honored by President Barack Obama with the Presidential Medal of Freedom for her revolutionary work in the fight against breast cancer. Welcome, Ambassador Brinker.
Thank you, Anita, and it's so wonderful to be here today with you and to celebrate all of you who created FLAIR. What a wonderful organization and how much you've done with the university, with American University, and this is yet another wonderful, it's more than a subject matter, it is a matter of great interest and should be for everybody now and forever in the United States to celebrate our First Ladies. So thank you.
Well, thank you. And that's one of the reasons why we're so honored that you would come on and speak with our audience tonight and our members, is because of the work that you have done with so many First Ladies. And of course, starting with First Lady Betty Ford, who was so courageous to go public with her disease. I wondered if you could, in the few minutes we have with you, give listeners a sense of what the standard of care for women, was with breast cancer before Betty Ford went public in 1974. And then by her doing that, how that paved the way for some greater openness.
Well, Anita, it's very interesting because I grew up and went to college in the 60s, and that's sort of when the women's health movement began to be prominent in the United States, realizing a lot of the research that had ever been done on women was actually done on men. And it was, a classic kind of thing that people started to become very aware of and said, gosh, how did that happen? Nice. But when Betty Ford came out, and talked about her breast cancer openly, I'm just going to kind of position everybody's thoughts into how it was at that time. Of course, my sister was in her late 20s. She was 3 years older than I. You could not say the word breast out loud in film, radio, television, or any kind of print media, number one. It was called the Big C. So people whispered about it. The other thing is that, you know, people were terrified of the treatment. We had reached an era where at the end of a very, very significantly, how shall I say it, really drastic surgery that women used to have called a Halsted radical mastectomy, in which most of the entire chest was removed of a woman, muscles, lymph nodes, tissue, all the way almost from her shoulder to her waist. Then a time came where they were doing lesser surgery. So Betty's disease, Mrs. Ford's disease, started, I believe, in 1974.
Right.
And what she did was apocryphal. She actually announced her disease in the presence of her husband, the president, threw a football while she was in the hospital to show people she could still move her arm, because there was an anticipated reaction that physicians had that the arm would get weaker. And in some people it did. But she was so brave, and she was such a beautiful woman inside and out. And the fact that she had the courage to step forward and say, I'm okay, and my husband's not going anywhere. And there was a real fear of that in these days. At the same time, concurrently, this was happening. Susan Komen was diagnosed, my sister, with breast cancer in 1977. And at that time, Mrs. Ford's disease had raised the mammography was still very new in the country. And the other thing that Betty did publicly was announce that she was taking chemotherapy, which was a very new kind of treatment being used. And my sister, who had a very serious breast cancer, looked at me one day and said, if Betty Ford can do this in public and have this treatment, so can I. She was a role model of my sister, and it allowed her to have more courage. Unfortunately, not the success of living. It was a very strange and strenuous time. But Betty was just a role model, so many of us. And then a few years later, after Susie died and I formed the Susan G. Komen Foundation, we invited Betty Ford to come for our first event and subsequently named an award after her. And for so many years afterwards, at least 15 or 20 years, she came every year to anoint another woman who fought a brave battle and gave hope to breast cancer patients in the United States and globally eventually. She was a tremendous advocate just by being who she was.
That's a wonderful description. And thank you for sharing all that too, and giving the frame of reference as to what it was like, and that optic of her to be next to her husband and him still with her, to give courage to other women that your husband or the man in your life won't leave you, which I imagine was, really emotionally very, very difficult for women. And then going, forward is because we're also talking about Nancy Reagan tonight, when she went public with the disease and then also faced a little bit of criticism for her choice, of treatment, and what it was like for you to, because I know you worked with her too on this.
Yeah. Yes. And remember, even Happy Rockefeller had been, but that was later diagnosed, vice president's wife. But when Nancy developed the disease, it was enough later that they were doing a little less surgery. They kept reducing the amount of surgery they had to do. And so the lumpectomy came into practice, and Nancy chose to have a mastectomy and was criticized by women who said, oh, well, that's just not the current thing to do. And why isn't she showing everyone well, you know why? Because her goal was to be in the role, again, live a wonderful life with her husband, who she adored, obviously. And she didn't want to be, have to be, working at something else. She wanted to live the life she had with her husband. She was very, very busy working on her initiatives, especially about the drug program and teenagers, and had many interests. And she wanted to go through it as effortlessly as she could. And she did. And again, she was another woman who did not let that get in the way of her relationship with her husband or anybody else. And people began to realize, just because there are options in disease treatment, it doesn't mean everyone has to do the same thing. And the group of women who were kind of critical were people who were kind of on the front of the political advocacy in a way that not everyone agreed with. We felt, of course, and supported her so much and gave her the Betty Ford Award a few years later. was because she did make her own choice. She was a very strong woman. She was a very beautiful woman, and she made her choice to not have any more surgery than she could just, know that it was removed and move on. And that's what she did. And I admired her, as did many, many millions of people for that.
Well, I know that, of course, over these years that you've founded Komen and other global breast cancer advocacy work that you have done. You've worked with a number of first ladies, including Laura Bush, who, of course, we both mutually admire so much. And one of the things I just want the audience to know is that you really helped to turn some of the most historic monuments around the country and around the world pink, including the White House, which was the first time the White House was ever colored with any other color but white. And again, in honor of breast cancer. And you did it with the pyramids and other places. But maybe you can just talk about that, just briefly, the other first ladies.
Let me go back in time again. And when we did the first breast cancer luncheon in Dallas, Texas in 1983, again, you couldn't use the word breast out loud. And it was very difficult to write this on an invitation that was going to go to 800 women in our town. And wouldn't you know, Laura Bush was one of the very first invitation chairs we had. It was a very important position. She had to hand address all those envelopes because we didn't have all that technology at that time. But more than that, again, she put her imprimatur on this issue by doing that. By people knew she was the invitation chair. They knew she was sending out the Susan G. Komen Breast Cancer Foundation invitation. That broke another barrier. Again, that people could come and gather, and some of the husbands actually didn't feel right about it. Laura made it in her wonderful, inimitable way, and as natural as could be, that this is the way it was going to be, and lived through it and helped us enormously. And they did one of their first events when they came to the White House, if you remember, the Pink Race for the Cure,
right?
And always were there for us in the state, and when he was governor and she was first lady there, and then later on.
White House.
Yeah.
Well, and you were kind to share a number of pictures with us of the leadership of First Ladies through history, and we will put those on our website and share those so people can see the arc of history of the work that you've done. Ambassador Brinker, we are so grateful, and thank you for sharing some personal reflections of Nancy Reagan and Betty Ford. And we're looking forward to our discussion tonight, and safe travels, as I know you're going to Germany again to talk about women's health and the index that you have helped to support on where we are today.
Anita, and to everyone on the FLAIR committee, thank you so much. I'm just going to say that still today we have it's the largest diagnosed cancer, breast cancer. 300,000 men and women are diagnosed with it every year. And I thank you again, as you have always helped, and to your committee. And thank you for recognizing this as an issue that First Ladies made an enormous difference in. And thank you for having me.
And you helped to change the world, Ambassador Brinker. Thank you. Thank you. Safe travels.
Thank you very much.
Okay. Bye-bye. Okay. So we can stop the video. And wonderful. Well, thank you for the opportunity to share some reflections from Ambassador Brinker. And now I want to bring in our distinguished panelist, Dr. Myra Gutin, who is Professor Emerita in the Department of Communication, Journalism, and Media at Rider University. She has a lifelong interest in American First Ladies and had the privilege to attend the first National First Ladies Conference convened by Betty Ford in 1984. She's the perfect person to be discussing Betty Ford tonight. She's the author of The President's Partner, The First Lady in the 20th Century, and Barbara Bush, Presidential Matriarch. Myra served as a special consultant to Smithsonian Institution's Traveling First Ladies exhibit during its sojourn at the National Constitution Center in Philadelphia. She has taught courses on the American First Lady in the 20th and 21st centuries and political communication, campaign persuasion, and the making of the president. FLAIR is the culmination of years of hoping and planning for the evolution of a national organization that would pull together research and education efforts about First Ladies. And Myra is honored to serve as the first president of our organization. Our other panelists tonight, which we're delighted to have with us, Jean Ryan Wolfson has a 40-year career as a communication strategist and public relations practitioner in Washington, D.C. She has significant expertise in integrated digital communications, public policy, communications, and media relations at the corporate level, as well as for large foundations. She's an inaugural lifetime individual member of FLAIR, of which we are delighted, and she has jumped right in and was selected as a contributing author for a chapter on Nancy Reagan for a new book that one of our other founding inaugural members, Molly Wertheimer, who will publish this next year. During the Reagan years, Jean was associate editor of the Washington Dossier, a magazine that covered social Washington and glamorous events that took place throughout the city in that time of the Reagan administration. So with that, I am going to ask Myra to do her presentation first. That will be followed by Jean's, and then we'll have some question and answer. It's all with you, Myra. Thank you.
Thank you, Anita. And good afternoon to all of our viewers. For those of you who are not of my vintage, let me begin by talking about how the Fords came to the White House in 1973. And they certainly came in a way that no one wants to come, and that is as a result of a national tragedy, the resignation of President Richard Nixon. Betty Ford had been asked a few weeks before they moved to the White House how she would feel if they would have to go. And she said, well, if I have to go, I'm going as Betty. And if they don't like me, they'll just throw me out. So right from the start, Betty Ford had a reputation for candidness and forthrightness. In her news conference on September 4th of 1974, the first full-fledged First Lady's press conference since Mamie Eisenhower in 1953, Mrs. Ford told reporters that she intended to be an active First Lady. She wanted to work for the ratification of the Equal Rights Amendment. She declared her support for abortion, and she certainly endorsed participation of women in politics. Just as that news conference was ending, a reporter asked her if she would look into the question of funding for cancer research. Mrs. Ford responded, I'll be glad to, only too happy. Her comments turned out to be eerily prescient. A few weeks later, Mrs. Ford's assistant, Nancy Howe, convinced the First Lady to join her in having a physical examination at the Bethesda Naval Hospital. The doctor who was examining the First Lady found a marble-sized lump in her right breast. He called on the chief of surgery to confirm his findings. These were communicated to Dr. William Lukash, the White House physician. Dr. Lukash, in turn, called the president and asked him to stop by the doctor's office that evening. Mrs. Ford was told to come a little bit later. Thus, the president knew that Betty Ford had breast cancer before she did. The doctors agreed that Mrs. Ford needed surgery immediately. A lumpectomy would be performed, but if a malignancy was found, then she would have a full radical mastectomy. Let me take you back for a few minutes to 1970, and I'm going to repeat a little bit of what Ambassador Brinker just said, but I think that it's really important to get perspective on Betty Ford's efforts. As she said, people rarely spoke about cancer out loud. It was the big C, it was the bad disease. I have a recollection of my mother-in-law who would talk about cancer behind her hand. It was terrifying, it was frightening, and as Ambassador Brinker pointed out, everyone was terrified of the treatment. The standard of care for treatment, again, as she mentioned in 1974, was a radical mastectomy, total removal of a breast, any affected lymph nodes, surrounding muscles, followed by chemotherapy or radiation to prevent further spread of the disease. On average, patients were staying in the hospital from 7 to 14 days, and reconstruction, as it were, by today's standards, was in its infancy. It's also fascinating to note that some epidemiologists, and this is 1974, really thought that there was a chance that cancer was a virus, so that people's interaction with those who had cancer could be very limited, and some people lost their jobs, and others found that their friends shunned them. It was really a terrible time. When the doctors told Mrs. Ford that she needed to have the surgery immediately, being Betty Ford, she said to them, "Well, I can't do it tomorrow because I've got a full schedule." And one of the items on her schedule was the dedication of the Lyndon Baines Johnson Memorial Grove on the banks of the Potomac River. Mrs. Ford had invited Lady Bird Johnson, former First Lady, and her 2 daughters to come to the come to the ceremony and then return to the White House for tea. When she learned that her friend was in the hospital having a mastectomy, Lady Bird Johnson was incredulous, and she just expressed just total wonder at the fact that Betty Ford had gone through this whole day of the celebration and then tea without saying a word to her. Of course, Mrs. Ford knew what was awaiting her at Bethesda, even harder to factor into all of this. The next morning, President Ford went to the hospital to be with Mrs. Ford. And I should also mention that when Betty Ford left for the hospital, the New York Times broke the story that Mrs. Ford had entered the hospital for exploratory surgery for a mass in her breast. That was the total announcement. The surgery took place. President Ford had gone back to the White House after seeing his wife, and he received a call from Dr. Lukash, the White House physician, telling him that the mass was indeed malignant, and the breast would be removed. And the president, who was working on a speech for an economic summit that day, excused himself from the Oval Office, and according to his counselor, Robert Hartman, walked into a separate room, sat down, and cried. Very, very emotional time. The photo you're looking at right now is Betty Ford right after the surgery, and she's being visited by the president, a family friend, and comedian Bob Hope, who was also a friend of the family. Now, right from the start, Betty Ford said, "I'm going public with this." She thought that the country could really benefit from a frank discussion of breast cancer. And she told me in an interview in 1979, and she said this to many people, but she said, "My feeling was if I had it, others had it. If I said nothing, their lives would be gone." Right from the start, as Ambassador Brinker said, she spoke about everything that she experienced. While she was convalescing, she also did something that got national attention, and we'll see that photo in a minute, I hope. The president had brought her a football that had been signed by all of the members of the Washington Redskins football team. Today, of course, it's the Washington football team. He gave it to her, and he walked down the hall of the Bethesda Hospital a little ahead of her. And as you can see, Mrs. Ford has the ball in her hand, and all of a sudden she threw it to him. And that picture made page one, all over the country the next day. And it showed people that the surgery was something that certainly with its many benefits, you were not necessarily going to be as limited as perhaps you thought. So even though it looks to be maybe a little on the silly side, it's really not silly at all. There was something really serious embedded in all of that. When Mrs. Ford was still in the hospital, the American Cancer Society noted an absolutely huge explosion of requests for mammography, for information about breast health, for breast examination. It's interesting to note that it was still 2 years, it was not until 1976 that the American Cancer Society had endorsed mammography as a test that should be done for women over 50 once a year. So this is 1974. Mrs. Ford returned to the White House, and much to her shock, she received 50,000 letters of support and encouragement from men, women, and children. Many of the letters that she received contained donations for the American Cancer Society in her honor. Mrs. Ford's picture was on the cover of Newsweek magazine under the banner headline, "The Operation," and scores of articles were written about her. Returning to the White House, Mrs. Ford began a regimen of chemotherapy, as Ambassador Brinker said earlier, and that chemotherapy would continue for 2 years. When she was well enough, in 1975, Mrs. Ford began to speak about this issue to the public. And in 1975, she spoke to the American Cancer Society. And we have that excerpt from that speech. I'm sorry, I'm not sure if the audio came through. Let me just share with you one paragraph from that speech. Mrs. Ford said, and this had to do with her decision to go public. She said, "That realization made me decide to discuss my breast cancer operation openly because I thought of all lives in jeopardy. My experience and frank discussion of breast cancer did prompt many women to learn about self-examination, regular checkups, and such detection techniques as mammography." She continued to speak. She gave, I believe it was 10 speeches about cancer. One other one that I want to mention took place in 1976. And this was the dedication of the MD Anderson Hospital and Tumor Institute in Houston, Texas. And we have a photo from that occasion. And I'll just share a little bit with you of what she said that day. She said, I come today with a very simple message to all who work to create and expand the Spine Institute. I want to thank each and every one of you for a job well done. As one of thousands of former cancer patients in this country, I know without the progress made at institutes like this one, I would not be alive. In 32 years of outstanding patient care and research, the MD Anderson Hospital and Tumor Institute has compiled an amazing list of accomplishments. Breakthroughs in drug development, therapy, detection techniques, and treatment advances make the University of Texas System Cancer Center one of the best in the country. During her time in the White House, and after she left 1600 Pennsylvania Avenue, Mrs. Ford continued to speak about breast cancer, and we know she also went to the American Cancer, Susan G. Komen luncheons every year when they presented their major award. It would be fair to say that Betty Ford dragged breast cancer out of the closet, brought it into the light, and put it on display. Happy Rockefeller, who was the wife of the vice president, credited Mrs. Ford's procedure for making her explore her own breast health and discovering that she too had breast cancer and then had her own procedure and was well. My colleague, Catherine Sibley, has pointed out that Mrs. Ford's actions were part of the early efforts in the fight to establish women's health as a major area of concern. Historian Alita Black writes that Betty Ford's decision to be honest about her breast cancer saved thousands of lives. Months after Mrs. Ford's surgery, the New York Times reporter Jane Howard wrote, if she achieved nothing else during her husband's administration, the light she shed on a dark subject would be contribution enough. Betty Ford's decision to go public greatly increased her credibility, and she amassed the moral authority that would make it possible for her to found the Betty Ford Center for the Treatment of Alcohol and Chemical Addiction a decade later. One last photo that I would like to show you, and I would like to say thank you also to the Gerald R. Ford Library and Foundation for the libraries, the photos and video that we've used tonight. We have a photo, not quite this one, but we have a photo of a van, it's one of a number of vans that say Betty Ford Breast Health, and they are seen throughout the state of Michigan. There it is, Betty Ford Breast Care Services, a living part of the legacy. To conclude, Betty Ford was a woman of rare courage. And like another First Lady, Eleanor Roosevelt, she would rather light candles than curse the darkness, and her glow has warmed the world. Thank you so much. It's my pleasure at this point to introduce my colleague, Ms. Jean Wolfson, who's going to be discussing Nancy Reagan.
Thank you, Myra, very much. I loved the photo of Betty Ford with the football. That brought back so many memories. Thank you for sharing such insightful remarks about Mrs. Ford. She was a true inspiration. I'd also like to thank Flair for inviting me on this program. Anita, thank you so much for your lovely welcome. And of course, I would like to thank Ambassador Brinker for her incredible remarks and everything she's done to, as Anita said, to change the world. So let's now turn to First Lady Nancy Reagan. Nancy's breast cancer was detected at a routine screening mammogram back in October of 1987. The first words out of her mouth were, I guess it's my turn. And she said she felt like she had been kicked in the stomach when she found out. Interestingly, she didn't want to tell the president herself. She asked Dr. Hutton, who was the White House physician at the time, to deliver the news. However, if you look back to when President Reagan was diagnosed with colon cancer, she would not let the doctors tell him. She insisted on being the one to tell him. So a little twist there. She said that one of the most difficult things for her was, upon learning what was happening, is that they had a planned state dinner for the Crown Prince and Princess of Japan. And she said she just couldn't talk about it with her husband before the dinner. She said, I knew if I started to cry, I would never get through the dinner. So we just really didn't talk about it. As Ambassador Brinker said, Mrs. Reagan chose to have a radical mastectomy and have no further post-operative treatments. The tumor was small and non-invasive, and rather than the lumpectomy. And as she mentioned, the lumpectomies were becoming sort of the option of choice at the time for that type of tumor. Another important factor about her decision was that she just wanted to have the mastectomy immediately after the biopsy results were known. Many women were choosing to wait a few days after the biopsy results to determine the surgical procedure, but she said she actually begged the doctors not to bring her out of the anesthesia and to discuss the results, but just go ahead and remove the breast right then and there. This is a quote from Mrs. Reagan. Please, please, if you get in there and find out that what you expect to find is true, don't bring me out to talk about it. I don't want to have any conversation about it. I've made up my mind. I want it done and over with. Please go ahead and do it. She said that she made this choice in part because because less extensive surgery probably would have required radiation or chemotherapy, and that would have interfered with her schedule as the First Lady. She said also that given her anxious nature, she'd be constantly worried about it coming back. And she wanted the extra assurance that the malignancy was out, even if it meant losing a breast. She said, quote, I couldn't possibly lead the kind of life I lead and keep the schedule I do, having radiation or chemotherapy. In an interview with Barbara Walters on 2020, she said, there'd be no way. Maybe if I'd been 20 years old, hadn't been married, hadn't had children, I would feel completely differently. But for me, it was right. She also was very clear that she did not want to have reconstructive surgery. I really don't want to go back in there, she said. The surgery was planned for October 16th. The White House made the announcement the day before she would go into the hospital. She really didn't want anybody to know at the beginning, including her children. But then she realized, wait, I have to tell my staff. So she told her press secretary, Elaine Crispin, and then her personal assistant, Jane Erkenbeck, because they would need to know for scheduling purposes. At the urging of her daughter-in-law, Doria, who was married to her son, Ron Jr., she changed her mind and did tell her children. So that was good. The White House was amazing in terms of releasing her health information to the public. They were very specific about everything. Then the New York Times ended up being sort of the paper that really gave extensive coverage to her illness. And it turned out to be a very powerful educational tool for women in this country. She, like Betty Ford, but I think her numbers weren't as high as Betty Ford now that Myra spoke. She received many calls and letters, Betty Ford among them. You can see here she is in this beautiful photo with her husband. She heard from Happy Rockefeller, Margaret Thatcher, the Nixons, everybody. And in total, she said she received 36,000 letters, cards, and wires. And then as the word got out, she began to receive a significant number of requests for media interviews that she would begin to do in the coming months. As Ambassador Brinker said, she did decide that the decision to have the mastectomy ignited a huge controversy from cancer experts and women's groups alike for being too extreme. People really second-guessed her decision. They thought that her choice of the more radical surgery might scare other women who could safely be treated by a lumpectomy from seeking treatment for breast cancer at all. There was one woman in particular I'll just cite, Rose Kushner, who was executive director of the Breast Cancer Advisory Center. She spoke out strongly and received a lot of attention. So I wanted to read the quote. She said that Mrs. Reagan's decision set us back 10 years. I'm not recommending anyone do it that way. And just to provide a little bit of context here, fast forward to 2013, when Angelina Jolie made a decision to have a double mastectomy, she was praised by the public for her brave decision. Mrs. Reagan was really resented what was being said about what for her had been an intensely personal decision. So in the following months, while she was still recuperating from her surgery, she had another devastating blow. Her mother died. So she really was in a very, very difficult period, yet she continued to resume her duties as the First Lady. She then went out and started speaking as an advocate for breast cancer through media interviews and also just receiving other awards. She really wanted to get certain messages out based upon her own personal experience with breast cancer. And I'm just going to give you a few of them right now. So the first was with her messaging plank, she stressed the importance of routine mammography in detecting breast cancer at an early stage. So that was the first message. Also, she reiterated that women should do what is right for them and to be afraid of the cancer, not the mammogram. She also defended her decision publicly. So here are a few quotes that are very powerful. Quote, "It was my choice to make, so don't criticize me for making what I thought was the right choice for me." She was also not pleased with the doctors who were not involved in her case, criticizing the treatment choices that she had made. And she stressed that it was she, not her husband, nor her doctors, who had made the decision about which treatment to follow. She said, "This is an extremely personal decision that each woman has to make for herself. Mine may not have been right for somebody else, but it was right for me." And as we know from the earlier discussion, she received the Betty Ford Award from the Susan G. Komen Foundation. And some lovely quotes that she said at that time upon receiving the award, which she said, "I never imagined that I would receive that award." But she said there's a bond of surviving breast cancer, and she cited Betty Ford. And she said that, "I know hearing the word cancer or malignancy can just freeze you with fear, but that fear should never stop you from facing up to the need for mammograms." Her words of hope were sort of related to to these quotes. Those words also don't have to mean the worst in this day and age. Even the word mastectomy is not as scary as it once was. And you can still lead a marvelous and full life. You can still feel great. You can still be feminine. Nothing basic to life or love or excitement need change at all. Here you see a few years later, she was continuing with her advocacy. She helped create the Nancy Reagan Breast Center at Adventist Health in Simi Valley, which the center is dedicated to help women with breast cancer. So awesome. As you can see by the date on this campaign slide, the center just celebrated its 25-year anniversary in 2019. A couple of years later, she also helped unveil the U.S. postage stamp, Raising Breast Cancer Awareness. And I believe we have a photo of her doing that. And there she is. She also continued to make infrequent appearances at various cancer centers. She met with the patients. She spoke about the programs that helped them and really gave them some hope. She said throughout her appearances, she was really amazed by how many women told her afterwards that they had had a mastectomy, but no one knew about it. Along the way, some scholarly research was conducted to show the impact of her advocacy. There was a study that was conducted by the CDC that showed an increase in women getting mammograms after her announcement. A study from the American Journal of Public Health showed a small sample of women in Long Island there was an increase in women getting mammograms, which they also attributed to her public announcement. And interestingly, there was a study on breast cancer advocacy in the Breast Journal, which praised the advocacy efforts of Betty Ford, Nancy Reagan, and Nancy Brinker in speaking publicly about the personal impact of the disease. So before I wrap up, I want to leave you with 5 quick takeaways about her legacy that we should probably all remember. 1, she talked publicly about her breast cancer treatment when it was still considered taboo in polite society, even after Betty Ford talked about it. 2, she helped break down the stigma that many women felt accompanied by a breast cancer diagnosis. 3, that a lot of people really sort of remember her as fiercely devoted and protective of her husband, the president, and the Just Say No campaign. But many others are now saying that maybe the most important thing that she should be remembered for is encouraging women to be proactive about their health. 4 is that among the 5 longest living first ladies, I want to get this correct, Bess Truman, who actually had a mastectomy, but she had it after she left the White House and she did not disclose it publicly. Betty Ford and Nancy Reagan were all breast cancer survivors. And my favorite part is that Mrs. Reagan's breast cancer never recurred, and it made her a 29-year cancer survivor. So thank you very much for your time today. And I'd like to turn it back over to Anita for the Q&A.
Thank you so much, Jean. That was terrific. And Myra, so really wonderful. Again, this program just was so inspiring in the way that both of you made it clear for our audience. What these First Ladies did was an educational tool for the country and for women especially. And we'll go to questions in a minute, but I thought I would pose this to both of you as First Lady scholars first. There really is no requirement that a First Lady do this. And that's what's so, remarkable. I mean, if the First Lady go public with a health issue, they may have, as you said, Jean, Mrs. Reagan considered it was very private and really was upset with the people who had questioned her decision. And it's very different because they don't have constitutional duties that they're responsible for the way that a president does. They're not elected. This is a private decision. I wonder if just both of you, now that I've got you together on the screen, can talk about the difference of how one over the other, one First Lady over other, was really treated for going public. And maybe Myra, you want to go first.
Well,
Why there was such a difference, I guess.
Well, Betty Ford was very popular, and she was blindsided by this, as Mrs. Reagan was. And I think she was lauded for her efforts to bring this to the forefront. I can't recall reading anything that was critical of her at the time. So I would just have to say, her efforts were applauded, and she is still held up as maybe the example of someone who, confronting something so potentially serious, is still willing to share that with a huge audience.
Jean?
Well, I really think that Nancy Reagan had been, before the diagnosis, she really had been criticized so tremendously when she walked in the door of the White House for some of the things that she had been doing that people might have considered frivolous at the time. But again, I think all of that stuff will continue to come out as well. And maybe it wasn't so frivolous in terms of what her intentions were. And so I think that she sort of went in there. It is totally different than the Betty Ford scenario. And I think that, just based on what I have been reading, the Washington press corps was sort of merciless on Nancy Reagan and really snarky. And, there's a lot of stuff. And you would think that after her own husband had dealt with his own cancer, in terms of colon cancer, and then here, I would think that would just sort of elicit some sympathy for the couple. Here they're in the White House running, well, he was running the country, but she did her share as well in a good way. I don't know. It just seemed it just seemed unfair. But I think that's really what happened. But I will say this, in all of the things that I have read since she died, the praise is unbelievable for what she did for breast cancer. So she really got her thanks and her recognition, unfortunately, after she died. But I feel like there's now a huge movement that people really recognize what she did for,
I think
for
the
women.
sensitivity, I think you're right on that. And I think the sensitivity to what the strength and grace she showed with her husband's Alzheimer's, which is another example of going public with a very difficult disease. And I wonder if one question that we have here too is about the White House, being so forthcoming with this medical information, really releasing a lot of detail about Mrs. Reagan's breast cancer diagnosis to the public. Had information like that, to your knowledge, been released in prior administrations? Both of you are communication specialists. Do either of you know the answer to that?
Mara, you may have more information on that than I do, but I do want to say one thing that I read that's kind of is kind of cute. That Nancy and Ronnie, they sort of had a joke, even though they didn't think it was really funny, that like, why did they have to show that level of detail about their surgeries? So sort of their colon, their breast. And so they would say, oh, let's turn on the news to get more detail on our private stuff. But I mean, because it was like, I think that was like when the news was starting to do that kind of thing. Like you got to know more than you ever wanted to know, right? About certain surgical procedures. But Myra, you probably have a better perspective than I do.
Well, certainly, when you look at what was released about Mrs. Reagan's cancer, you certainly say TMI.
Yeah.
Really
Totally.
to know this. I really didn't.
Mhm.
Well, the same level of information was not released about Mrs. Ford's cancer. There was certainly material about the procedure. Doctors chimed in with opinion pieces about the treatment, what she was going through, her chances for complete survival. And by the way, she too was a lifetime breast cancer survivor. But prior to Betty Ford, the White House was not forthcoming with details about the medical concerns of any of the first ladies. Now, I know that Mrs. Harding released her own information about her various problems, but I think back even to Jacqueline Kennedy and the birth of her child who died, Patrick, and very, very scant details were available. So
that I think Mrs. Kennedy, I think probably did not want much information shared. She didn't want much information shared about her family generally, and controlled that. But again, very private, very personal, and very painful to be sharing that, with the country and the world potentially. Do you think either, if I can ask both of you too, one question we had here about, did having to go public with their disease, did it change their attitude about their role as First Lady? I don't know who would like to start with that first. Jean, would you like to go first?
great question.
It is a great question. I would say so, because to a certain extent, because it seemed as though I mean, from what I understand, Nancy Reagan didn't make a ton of appearances, and she sort of was very selective about things. But I do think she realized the influence that she could have on and make it sort of relatable to American women in America. And I do think she began to thrive with that, from what I can tell. Also, it just gave her more sort of incentive to continue going gangbusters with Just Say No and with the foster grandparents program. And then ultimately, as you mentioned, Anita, I'm so glad you brought that up, the president's battle with Alzheimer's, which she was just an unbelievable champion. So I feel like she found her rhythm, she found her momentum. And, some of the other stuff, some of the trivial stuff was going away. And actually you could even see the journalists, some of the journalists became very close friends with her. The ones who were very critical of her became her closest friends towards the end.
Right. It's a good point. Myra, anything to add to
Yeah,
that?
of something that Betty Ford wrote in her biography, Anita, and I don't have the exact words, but the gist of it was, lying in my hospital bed, I came to realize the importance and the impact that the woman in the White House could have. And she says, not me, but the power of the position. And I think, as Jean pointed out with Nancy Reagan, Betty Ford really did not have, at that point, any journalists who were really negative about her, but they became even bigger cheerleaders. And she generally had a very, very positive press. Nothing really ever set that back. She did get into some trouble over an appearance on 60 Minutes, but because she had piled up all of this good feeling and such respect, over time that resolved itself.
Well, I think both of you have done a terrific job sort of painting a picture of just the courage, the leadership, the opportunity that these women use this very personal, terrible instance in their personal life and private life, use it as an opportunity to use the First Lady platform in such an incredible way that changed not only life for women at the time, it's really changed for generations to come. And they found their voice through a tragedy in some way, and we're the better for it. And you, both of you, I want to thank you for helping to really shine a light on what the circumstances were for these two women at the time, how extraordinary their act of bravery and courage was, the leadership that they have shown us. And so with that, Myra, I'd like to ask you to give us some final thoughts and what our next program might be, Madam President of FLAIR. And thank you very much, Jean.
Thank you so much for having me. Thank you.
Thank you, Anita. Thank you, Jean. Thank you behind the scenes to our treasurer, Diana Carlin, and to Will Butterbaugh, who helps us with these programs. FLAIR is happy to have sponsored this program today. This is our fourth program online. I'd like to pull your attention to two other programs that are coming up. On the 22nd of November, we'll be discussing Abigail Adams, and our speakers will be Sarah Martin and Catherine Algor of the Massachusetts Historical Society. And in January 13th, 2022, Elizabeth Natali, Barbara Perry, and Colleen Shogan will be speaking about Jacqueline Kennedy. We look forward to seeing you at future programs. Please check out FLAIR. Our email address, the address for our website is flair-net.org, and we look forward to seeing you in the future. Good night.